organizing for home care for our patients. What I advise is that you do it prior to needing it. That way you have an idea of where you're going and what you're doing when the time comes to need it. There's multiple different avenues that you can go through to help you besides getting paid help. You just have to be willing to do it. I advise some of our patients to use a website called the Caring Bridge. No? Can you guys hear me? No.
It's not real clear.
How about now?
Is it .org?
.com.
Okay.
CaringBridge.com. How about now?
Yes.
Okay. CaringBridge.com is a website that you can go to organize your care for your patient, spouse. You can make a calendar, and then if you have other family members, friends that are willing to help, they can also go to that site, and it's kind of in the same way where you go on a Facebook page and you can see that person's page. You can go to that calendar, and if you say, you know, Sue is going to help on Mondays and Wednesdays to wash the clothes or sit with Bill while you go grocery shopping, then they can plot the times that they're willing to come throughout that month, and so can everybody else, and they can all look to see when there's vacancies or when things are full, so that you have an organized caregiving for everybody. I highly suggest to get as many family members as you can to help, to lessen the burden. Friends, some people don't want to ask their friends for help, but if they're willing to help you and they ask, can I do anything for you, then let them, because they wouldn't ask if they didn't want to. Some people say, well, I don't want to pay an agency because they're going to charge too much. If you've got a friend that's willing to do it, and you can charge, or they can charge, you know, $7 or $8 or $10 an hour versus an agency going and paying $20 an hour, then you can do that. Sometimes I'll tell patients that they can go to local colleges in the nursing programs or PT programs, or, you know, some kind of medical program, and they usually have a bulletin board. You can stick, you know, a wanted caregiver, because they're always looking for part-time jobs. You know, that works. Your church usually is a very good resource. I've found that most patients and families say that if they have a good church, that they really go above and beyond in helping them, whether it be meal organization or coming and sitting. I've had some patients say that the men's group in their churches came out and built a ramp. Didn't charge them anything. They didn't even have to buy the material. So you just have to look for the avenues besides paying. Why do you need home care? Because ALS is a progressive disease. You have stress and caregiver burden, and you need all the help that you can get. You may need it just for respite care. Say you're going to go away for a few days, and you need somebody to come and sit, then that may be an option for a caregiver. It may be that the patient has no family that lives, they're not married and they don't have any family that lives around. They may eventually need a primary caregiver if they don't want to go into a nursing home. So they have to look into hiring somebody full-time to take care of them. Another reason is to ensure proper care of the patient's management of their symptoms. As things progress, there's a lot to take care of. There's several different types of home care, and a lot of our patients think, well, Medicare says that they'll pay for home care. They do pay for home care, but they pay for acute care and not the care that most of our patients need, which is in-home care. So I'm going to go through the differences in home care. Your general home health for acute care Medicare will pay for that. Some private insurance companies will pay for that. Medicaid will pay for that. Usually that is, like Amber was talking about, if you have a decline in your physical condition, she can order physical therapy for you or occupational therapy for you short term until you've reached a goal or plateaued. And then per Medicare standards and their guidelines, you have to discharge that patient. So it's not a long-term, ongoing kind of care. They don't do shift work, which most of our patients need, where they come in and stay 2 to 4 to 24 hours a day. They come in a few times a week, check on the patient. They're there maybe 30 minutes to an hour, do their treatment, teach the family, the caregiver, and then they leave. The other type of home care is private duty in-home care, which is what most of our patients need, and unfortunately Medicare doesn't pay for that. This is long-term care, provides aides, nurses. They come in, stay with the patient, do bathing, ADLs, feeding. They may cook for them, do laundry for them, clean the area that they live in, that kind of thing. Medicaid will pay for that. And some private insurances do if you have a skill. What I mean by skill is that it usually has to be a nurse if it's a private insurance company. And if a nurse is to come out, there has to be a skill that that nurse is qualified to do. So that would be trachs, peg tube, that kind of thing. Just to come in and give a bath is not a skill that a nurse needs to do. So therefore they justify that as saying, well, there's no reason that you need a nurse. So they're in private insurance companies, they will not pay for that. And they also will pay for respite care too, in some private insurances. The last home care is palliative or hospice care. Some of our patients use palliative care and hospice care. Not all of them do. A lot of patients don't want to go down that avenue because they think that that's the end and they're about to die. And that's not true. We've got some patients that have been on palliative care and hospice for several years. They provide some relief for the caregivers because they do offer social work assistance. They don't come in. They do much the same as what a regular home health agency would do, in that they just come in, do their visits, and then leave. And they come in maybe once a week to several times a week. They do have either a doctor or a nurse practitioner or a PA that comes in maybe once a month or so. We'll check on the patient if that patient's not able they come in. Palliative care, at least around in the Charlotte area, in order for you to be part of palliative care, you have to be able to go into their facility or their office. And the difference between the palliative and hospice is that palliative is less than, palliative care, they allow you to not be in that 6-month window. Although even hospice, some of our hospice patients have been on hospice for longer than 6 months. But the difference is that you have to come in to make those visits, just like you would a normal doctor's office. Like I said, some people think that hospice is, their last step. But we've had a lot of success with our hospices around here in Charlotte. They're very helpful with our patients. The only thing that we do recommend is that you get all the large equipment that you need, such as your wheelchairs, your Trilogy machines, which is the breathing machine, that kind of stuff, because hospice will not pay for that stuff afterwards. We will write all the orders if you'd like us to. All you have to do is call me. That's part of my job. So if you're contemplating home care or hospice, you can either give myself or Nicole a call and we can order it for you. Some patients go to their primary care doctors to get it, and that's okay too. But just so you know that I'm there to do it if you need somebody to do it for you. There's grants that will help pay, because home care is very costly, especially the type of home care that our patients need, because most of our patients, are in middle class and they don't have abundance amount of money to afford to pay for a caregiver around the clock. Sometimes caregiving can cost up to $100,000 a year, depending on how much care you need. I'll give you some of the grants that we have. The Mike Rucker grant is our grant from our office. It's for caregiver assistance. You can apply for that every 6 months. The ALSA grant.
Spell that, please.
ALSA, A-L-S-A. North Carolina is the Catfish Hunter chapter. There's also a South Carolina chapter for our patients that live in South Carolina as well. You can apply for the ALSA grant quarterly to help pay for caregiver assistance. They also have other grants as well that pay for transportation, that pay for things such as generators, backup generators, equipment that's not covered by insurance. You can submit that to them and they'll try to help you pay for that. The Good Foundation grant is a local foundation here in Charlotte. Alexis Argood was a lady that had ALS, and her family started a foundation after she passed. And Marie Wright is the lady that is over that, and I submit those grants, and so does the other team members for our patients. Normally I do those about every 6 months too, but she will agree to help pay for just about anything. Amy uses them a lot, the speech therapist, for getting iPads for our patients that can't speak. Amber, I know, uses her for different smaller equipment that's not covered. I've used them to pay for Lifeline monthly bills for our patients that need Lifeline and they can't afford the monthly payment. I've used them for caregiver assistance. So she'll just about give you money for anything that you may need that is medically related to your ALS. There's a new foundation that our social worker just found out about, and they're out of California, and it's called the Guardian Angels ALS Foundation, and they do caregiver assistant grants too, and I've submitted, I think, about 4 for some of our patients. I know of one patient that has received a grant from them so far, but this is just a recent foundation that we found. And then the last one that we know about is called the Ride for Life grant. Which also helps to pay for caregiver assistance. Not a lot of options out there for grants, but as soon as I find more, then I just stockpile them so that I do have options for our patients. Care for ALS patients at home is very taxing as the disease progresses. I just wanted to kind of highlight some things. Mike spoke about proper diet and nutrition. It's very important, like he said, to get adequate calories, adequate hydration, and we strongly encourage peg placement when those things are not easily managed orally. There's a lot of issues with elimination, using the restroom. Could be just physically. Some patients have problems initially starting to go to the restroom. But a lot of our patients have told me, I work my day around when I have to go to the bathroom. I don't pee, or I don't drink because then I'll have to pee and I'm somewhere where I can't pee, which is not good. So we're there to try to help you figure out ways to improve this. Hygiene and personal care are another big issue for our patients. As the disease progresses, it gets harder to stay independent in bathing, dressing, that kind of thing. There are options to help you with these things, and again, that's why I'm here, and Amber's here, and Mike's, Scott, all of us, Velma, are here to kind of help you figure out the easiest way to do these things. There's lots of equipment that comes along with caring for an ALS patient. Some people have told me, I feel like I own an equipment store. I've got so much stuff. And from the hospital beds to the Hoyers to bedside commodes to tub benches, chair lifts, walkers, canes, splints, all kinds of stuff. Respiratory hygiene is extremely important for our patients, and Velma will talk about this in just a few minutes. But you have lots of respiratory equipment too. Trilogies, non-invasive ventilators. If patients opt for a trach, then you have the Trilogy can convert to an invasive ventilator. We have suction machines, cough assist machines, vest machines. Communication is extremely important for some of our patients that lose their ability to speak. It's extremely important to allow the patient to maintain that sense of importance, to be able to communicate their own needs. There's different devices that Amy has. It could be as simple as pen and paper, the boogie board that Mr. Alex is using, iPad that Billy uses. We have letter boards, clear letter boards. We have eye gaze systems, computer systems that our patients use that no longer have use of their hands. Some of our patients now use their smartphones too. Next is psychological support. I believe it's extremely important for our patients and our caregivers because it's a big stress and a big burden. There's a lot of grief, and I think that it's important for our patients and the caregivers to get the support that they need, whether it be from us, whether it be from Lucas and the support groups that he puts on. ALSA also puts on support groups in the area for our patients. And a couple other things, recreation and activity. I believe it's extremely important for our patients to maintain their level of activity and what they were doing for as long as they can do it safely. Just because you have ALS doesn't mean you can't go on vacation. It doesn't mean that you can't go to the beach. It doesn't mean that you can't go to the movies. There's ways to do things that you just have to modify. And we, again, are here to help you do that. Home modifications is our last thing. Because things change in our ALS patients, there is a lot of home modifications that you probably will end up doing. It may be as minor as, right now, as just moving furniture out of the way, so you have a wider path, so you don't fall and trip, or trip and fall. It may be widening doors. It may be a ramp, because you're not able to go down the stairs. Maybe stair lifts if you have an upstairs bedroom, and you put in a stair lift. To as big as remodeling a bedroom and bathroom. The last thing I wanted to talk about real quick was the other payer source for our patients to provide in-home care would be the VA. The VA has made our patients that have ALS, if they have a diagnosis of ALS, they're 100% disabled according to the VA. So they will get benefits once they're registered with the VA. They also will pay for home modifications to make their home handicap accessible. They will pay for handicap modifications to vans. So say, like Amber was talking about, you buy a van, you have to pay out of pocket for the van, except for how much did they allow? 20?
See, my van was almost $70,000, and I paid $18,000 out.
Right.
So they paid.
They pay a portion to the van, and then they pay for the entire modification to make it handicap accessible.
So the first-time grant is an $18,500 first-time grant. You can buy any kind of car you want to, and then they'll pay for the conversion equipment
Right.
that they feel is necessary to modify that.
Right. They also provide aid and attendance money, which can be up to $8,000 depending on the severity of your disability at the time. And that money, some of our patients, just use it to help pay for things in their home. Some people, it's intended to help the patient and caregiver pay for somebody to come in and assist in caregiving. Some of our patients do that. Some of them just use that money to help with other things. They will also provide 2 or 3 hours. 3 hours.
I get 3 hours a day, 3 days a week.
Yeah, of caregiving that they provide that you don't have to pay for. So, unfortunately, you have to have ALS to get those benefits, but at least the VA is helping our vets. And that's all I have. Does anybody have any questions?
You might mention the Joe Martin ALS.
Yeah, the Joe Martin ALS Foundation is a local foundation that will come out and help. I know there's a max capacity right now, so they're not accepting any new patients, but they will come out. It's a free service You get them several times a week?
I do them
Twice a week?
Range of motion.
Yeah. They do range of motion with our patients. They, if range of motion isn't that big of an issue, then they just do, you know, basic caregiving assistance. I know some of them will take our patients to clinic because they have a handicap van, and if they don't have transportation, then they'll bring them to their clinic appointments. So they're wonderful, wonderful, wonderful people, and we work real close with them. They've just put together a website, and I wish I had it with me. But you can, if you email me, I can give you the website for their for them. It's a website, an informative website where they've taken every part of the house and showed you ways to make it handicap accessible and the things that you may need for that area. It's very user friendly. So we at the clinic kind of help them to make sure they've had different things in the website that would help our patients. So it's really great, a tool. You know, if you don't know, oh, well, maybe I need this, but I'm not sure what kind I need. You know, I need a tub bench, but maybe, do I need a little tub bench? Do I need a sliding tub bench? Do I, you know, it goes over a lot of different things throughout the house to help you maintain your independence. Yes,
Did you say that the Alto is a new grant?
The what?
Alto, what did you say, the Alto grant?
The Guardian Angels. Is that what I said? That's the one that's new that I just found. Guardian Angels ALS Foundation. They're out of California. But I talked to the guy and he said it didn't matter what state you lived in, that you could apply for it. Is that the one you meant?
Should also.
Oh, the also grant.
Do you have the applications?
I do. Yeah. You just let me know if you need any, and then I'll submit them for you. Yeah. Anybody else have any questions?
The support groups that you talked about, are they for patients only, or patients and family, or just family? Or
Both.
all three?
Both. Lucas does the one, and it's for both. There's a,
When did we get home?
We actually host, the MBA hosts three, so the second Tuesday of every month, we host one in Pineville, and that's for both caregiver patients. The third Tuesday of every month is in Fort Mill, and then the last Tuesday of every month in Huntersville, that is with a caregiver group as well as a patient group. So those sometimes meet separate, sometimes meet together.
Okay, because one of the challenges that we're having is, my dad is, he won't open up. So I'm thinking that maybe if you were around other patients where maybe you feel more comfortable talking, you know, where they can give him the support that we can, because he won't talk.
Yeah, and if he's not ready for a group, I can also try to connect one-on-one. Oh, that's something we can move on to. Some people are not ready for the group as well.
Can I also talk about, there's a caregiver
Yes.
support group sponsored by the June Catfish Hunter ALS group out of North Carolina, out of Raleigh. And they have a meeting the first Sunday of every month, and it's for caregivers only, and it's a very good forum.
it's in Matthews, right?
It's in Matthews, it's at the New Avant Health Hospital in Matthews, and it's from 2:30 to 4, first Sunday of every month. Very helpful.
If you'd like to see information on any of those, please just let me know, and I can make sure you see
It's for
flyers.
caregivers only.
Where is,
It's at New Avant Health Hospital in Matthews.
Which would be Frisbee Matthews.
But caregivers only with the forum.
But all three that you do are both, correct? But then the one in Huntersville, they sometimes meet together, sometimes separately. Is that what you're saying?
Yeah. So there's a caregiver group and a patient group at the same time.
Mm-hmm.
And often in the same room, but sometimes we try to split up.
I know they run one in Fort Mill.
But yeah, Fort Mill is a fantastic ALS specific group. There's several people here who attend that.
That's the one that we go to.
Well, he's going to that one, but I know they go to that one.
Is it your mother
Mr.
and
Johnson?
your father? and-
My father really goes.
Yeah. Willie. Yeah.
He is a fine guy.
He needs to talk more at home then.
Anybody else have any questions?
Didn't you have one on call once?
Yes, and actually, our Columbia office has started hosting an ALS specific call on the third Tuesday of every month. And we're trying to send information on that as well. For the people who maybe the groups are too far, they can't leave the house as easily. It's a phone call conference. It's on the third Tuesday of every month. That's ALS specific. And that basically is patients from North and South Carolina, all over the state together. Yeah, definitely heard about that.
All right. I know most everybody knows everything that I do. Don't quite know you guys, but my job at the clinic, just so that you guys know, is home care coordinator. I'm kind of a jack of all trades, master of none. I'm in the office a couple days a week, but the rest of the week I'm